Hi there, Jenny here with Face to Face Spa. I just wanted to do a brief overview video for our mid-level practitioners for the new workflow for delegation orders. These delegation orders, there are 4 different order types that do require an official order on the chart by a mid-level practitioner or a physician for delegation to an esthetician. Okay, these medical grade services that do require an order are dermaplaning, which also includes the dermafacial, obviously, skin pen, microneedling, and then skin pen with PRP, and also our advanced grade medical peels. In some states, there is also an order that's required for microdermabrasion. And unfortunately, Texas is not one of those states, but if you are in a state such as Mississippi, you would also need an order for microdermabrasion. Nonetheless, we're just going to walk through the workflow of how to do this most efficiently. Our goal is to ensure that every single member at our med spa does receive a good faith exam from a mid-level practitioner. This is an amazing time and opportunity for you to also introduce yourself to the client and let them know that you'd love to book them for a full advanced skincare consult if they were interested. So we're going to go ahead and get started on the standard workflow on how to get these standard delegation orders. So this is just to get them approved for these orders so that they can receive these orders in the future. Okay, once they're approved for that order is good until it's discontinued. So one order is good for the lifetime of the patient unless the patient needs to have a change in their medical condition, such as pregnancy or breastfeeding. Then that order obviously would need to be updated if there's any changes in their health. Some states do require a renewal order every year. Texas is not one of those states, so please check with your state regulations if it's required to have an annual order for that. But for the most part, as our main goal and objective today is to ensure that 100% of our members receive this good faith exam so that they could take advantage of the full benefits of their membership, including the ability to receive a skin pen and dermaplaning and advanced grade peels. So we have a new appointment type, and it is called the Good Faith Exam. Okay, and so you can see here, I booked one under Brittany. So this is the Good Faith Exam appointment, and it's $0. It's free to most of our clients unless the owner of your location chooses to charge for this. So please check with the owner to ensure that it is a free consult so that you don't misquote your client. At our corporate stores, we are doing this as a free consult for all of our clients. And so let's say that you're in the iPad, and I can't demonstrate the iPad on this desktop just because it wouldn't allow me to share my screen. But if under more, you're going to click show treatment and consent forms. Okay, and this is going to be the options that are available for them to fill out. So when the client comes in for their good faith exam appointment, they're going to complete the good faith exam client intake form. Okay, this intake form is going to ask them if they are interested in receiving more information about medical cosmetic services such as injectables, chemical peels, and exfoliation services. And it's also going to ask if they want to receive more information about medical weight loss. Okay. And then we're going to go into the Fitzpatrick scale. So the Fitzpatrick scale is going to ask them if they are a Fitzpatrick 1 through 6. The reason you want to know this is this will determine what peel types are most appropriate for. In general, a client that is a Fitzpatrick 1, 2, or 3, okay, they're approved for all skin types as long as their skin is non-ethnic. Okay. This means if you're Caucasian and you have a Fitzpatrick 1, 2, or 3, they're generally approved for all peel categories. If they are Fitzpatrick 4, 5, or 6, this is going to be more Latino skin types, Mexican American, Puerto Rican, African American, Asian. Those skin types are going to be more high risk for chemical peels. So basically, they have more melanin capacity, which can react to the peels. And so you can still approve them for superficial peels, but you may not want to approve someone with very dark skin for advanced grade peels. Okay, so when you approve them for chemical peels, you want to really assess this Fitzpatrick. So Fitzpatrick 1, 2, or 3, Caucasian skin type, you are good to go with all of the peels, generally speaking. Okay, 4, 5, or 6, because it's higher risk, you're going to allow them to do superficial and moderate grade peels. But you're going to maybe not approve them for the medical grade peels. That's going to be your main concern. And then obviously you're going to want to screen for some allergy information. We'll go more into the allergy information on peels so that you can write those down. But this also prompts them for their ethnic group so that you have it in writing so that can help you make your decision better. Are you currently under the care of a physician for any reason? Please check this box as it applies for your current or past medical history. This is going to prompt to see if they have hepatitis, HIV, pacemaker, a history of staph infections, if they're on antibiotics, if they have diabetes, high blood pressure, skin cancer, all of the above. And sometimes that can help you. If someone's on current chemotherapy or radiation treatments, you do not want to approve peels until those are resolved. They need to wait 2 weeks before and after any radiation or chemotherapy round before they want to do a peel. Other things to be concerned about with peels is you want to make sure that with chemical peels that they don't have an allergy to the ingredients in the peel. And we'll go more into that, like I said, once we complete this. So female patients, you want to know if they're pregnant, trying to conceive. That's going to be a contraindication for any of our medical grade services. Okay. They can breastfeed but they can't be pregnant. Okay. So they can breastfeed, but they do need to hold their milk for 24 hours before and after, or I'm sorry, after a peel, they need to hold their milk for about 4 to 6 hours. And then after that, anything that did get into the bloodstream would have been cleared by the kidneys. When their last menstrual period was, just to determine if they're not pregnant, and then check any current symptoms or conditions, immunosuppression, problems with bleeding or blood thinners. That might be something that you want to keep in mind with someone who is going to be receiving microneedling, for example. Recent illnesses. You want to know this if you're going to be doing filler injectables. So this good faith exam is also the form that you want them to complete when you're doing your own filler and Botox injections as well. It just kind of prompts them for that. Enlarged lymph nodes, fever or chills, and then their social history, such as alcohol use and cigarette smoking for your injectable orders. But nonetheless, this good faith exam is now going to be kind of like the medical intake form that we're using for all medical grade services, whether you're delegating orders or performing services that are medical grade yourself. Once you've reviewed this, you do have to do a face-to-face interview with a client. This means that you're not going to do it over the phone. You have to either do a teleconference, face-to-face interview, in person, or through the video conference. Okay, these appointments don't need to take a whole long time. They don't need to take a long time. This is maybe a 2 to 3 minute interview just to screen for the basics. Okay, obviously, do you have a history of Guillain-Barré? Have you ever had facial paralysis, anything like that with the for the Botox injectables? Are you allergic to egg whites? If you're trying to approve them for the chemical peels or whatnot, you're going to screen for those allergies. But if they don't have any allergies, that's an easy check off. So now you go to your standing orders form here, which you'll find on your iPad. It's just another one of the charting forms. And you're either going to put approved, not approved. And then here for microdermabrasion, approved, not approved. Chemical peels, approved, not approved. Okay. If you click not approved, there's a note section that you can go ahead and chart why. You could say pregnancy, whatnot. For dermaplaning, you're going to approve clients as long as they don't have severe cystic acne, because that would be contraindicated for someone, because when you're going over with that dermaplaning blade, it can kind of be higher risk for someone that has cystic pustules on the skin. Microdermabrasion, you don't want to approve this for someone that has superficial blood vesseling. That if you see the superficial blood vessels, that suction from the microdermabrasion can sometimes make those sensitive vessels that are already compromised, even they're already weak, but it can cause them to surface even more. So if you see signs like that, you may not want to approve them for microderm. Chemical peels, again, we have superficial strength, moderate strength, and advanced strength peels. You're going to you would approve most clients for superficial and moderate, but you may not want to approve anyone for an advanced strength peel if they have ethnic skin, or if they're a Fitzpatrick 4, 5, or 6, which means darker skin tones. Okay. Aspirin allergies, avoid peels that contain salicylic acid. So these are prompting you for the most common allergies. If they have an aspirin allergy, you want to make sure that you're avoiding the salicylic or the Jesner's peels. If they have a lactose allergy, you need to avoid the lactic and Jesner's peels too, because the Jesner peel is your combo peel. We have skin pen orders. You're going to avoid people that have keloid scarring. Okay. And other than that, if they have any bleeding disorders, you'll want to have some precautions with that. And then you can also approve them for PRP as a gliding agent. If they are approved for skin pen, they're usually going to be approved for PRP. Botox, you would need to go ahead and give yourself your own orders, and all the orders are here when you click on that. It tells you what your protocols are for that. Now, let's say that some of the client's in the room and you're not busy, and let's say Sarah over here is already in her appointment and she wants to receive dermaplaning, but she doesn't have standing orders. Well, you can just pop in the room and do a verbal interview with her. And even with a verbal interview, you can have her fill out that GFE, or you can fill it out for her verbally while you're asking her and prompting her for questions. Let's say she's on the client bed. Okay. Even these appointments here, you don't have to book a good faith exam. It's already attached to every single appointment that we have on the menu. So if you do want to just pop into a room, you can just go into the standing orders form and go ahead and approve them right then for the approved services. I hope this was helpful for you. Thank you so much. And please don't hesitate to text me if you have any questions. Thanks.
Wag niyang ano.